Hello guys, today I'm going to be talking about cervical cancer. Cervical cancer is the third most common cause of cancer in the female genital tract in Nigeria and both in the United States. And studies have shown that the first two are the ovarian cancer and the endometrial cancer. Yeah, so this it has a peak incidence in women within the age of 35 to 45 years of age, and it's usually caused by persistent infection with the high-risk human papilloma virus genotype. And human papilloma virus genotype is the commonest thing that we notice to be associated with the cervical cancer, hence making it the cause of cervical cancer. There are risk factors that are associated with cervical cancer, and they are as follows. The first on my list is multiple sexual partners. People with multiple sexual partners are at risk of coming down with cervical cancer, yeah, as well as those that are immunosuppressed, like those with HIV/AIDS or any chemotherapy or anything bringing down their immune system. Yes, because the body will not be able to really fight against this HPV infection. Also, smoking has also been associated with cervical cancer. What are those things? What are the signs and symptoms you will see during the abnormal signs you might see? Although sometimes at the early stage of cervical cancer, it's usually asymptomatic. So before you start seeing these signs and symptoms, they usually come at the late phase. Yeah. So the symptoms you might see or you will see during this. Remember I told you cervical cancer is usually asymptomatic in the early stage, and the symptoms typically develop later in the course of the disease. So the early symptoms you might see include abnormal bleeding, irregular vaginal bleeding, which could be heavy, or irregular menstrual bleeding. Then also you could also get postcoital spotting. When I say postcoital, that is bleeding after sexual intercourse. Then again, you could also get the person could also present with abnormal vaginal discharge. Yes, the discharge is usually described to be blood stained and purulent malodorous. Yes, usually that bad. We call it purulent malodorous discharge. Again, they also do come with pelvic pain as well as dyspareunia, that is painful sexual intercourse. Then at the late symptoms that might present, that is usually at the let me say close to the end stage. Yes, they present with adrenephrosis and then lymphedema as well as fistula formation. Yeah. So on cervical examination, when we're doing our cervical examination, we notice that there are ulcerations or induration of around that region. So if you really want to know about the pathology and the staging of cervical cancer, you can just kindly give me a hi on my comment section telling me that you need a part 2, and I'm going to give you details on it, more especially the medical students who would be needing that for their examination. Yeah, so I'm just going to talk about the prevention. The treatment is based on the staging of the cervical cancer. Yeah, how can we prevent cervical cancer? Yeah, it's a cancer that can be preventable. That's the good news. Now all we need to do is to try our best to see how we can prevent it by doing the following. So the first on my list is I'm going to break it down to the primary prevention and the secondary prevention. So for the primary prevention is for those that have not really gotten it and might be at risk of getting it. So first of all, you have to do your HPV immunization. The human papilloma vaccine immunization must be done. Yeah, you can go to a health center and tell them that you want to take your HPV immunization. Yeah, for those that are above the age range, they will tell you to do a pap smear, which is a test to detect or to check if this person has been infected with this virus before now. Barrier protection is another means. However, I don't consider it the safest means based on this virus can still be transmitted through it. So yes, it's a means of protection, but not 100%. Yeah. Then the second prevention is by adhering to frequent or continuous cervical cancer screening, going for your pap smear, and early detection of this virus. Yeah, in conclusion, so for you to prevent cervical cancer, you have to reduce your sexual partners, stop smoking, and as well as do your frequent or regular screening and get immunization, as well as um, living a healthy life. Thank you guys. Kindly like and subscribe. Follow my YouTube channel, and if you have any question, you can put it on my comment section. I will surely answer you. Thank you very much. Bye.